If you are on Medicare right now, what I am about to tell you in the next 20 seconds could save you hundreds, possibly thousands of dollars this year. March 31st is the absolute last day to make a change to your Medicare Advantage plan for 2026. After midnight on March 31st, that window closes completely, and you will be locked into your current plan until next January. And here's what concerns me. Most Medicare beneficiaries do not even know this deadline exists, which means right now thousands of seniors are sitting in plans that are costing them more money, covering fewer doctors, and denying claims they should never have had to fight simply because they missed a deadline they were never clearly told about. Stay with me, because by the end of this video, you are going to know exactly what this deadline means, whether it applies to your situation, and the specific steps you need to take before March 31st to protect your healthcare and your wallet. Let me start with why this particular deadline matters so much more in 2026 than it has in previous years. Medicare Advantage plans. These are the private insurance plans that replace original Medicare and are offered by companies like Humana, United Healthcare, Aetna, and others have been going through significant changes. In 2026 alone, dozens of Medicare Advantage plans have reduced their coverage, increased their out-of-pocket costs, narrowed their provider networks, and in some cases, exited certain markets entirely. What that means in real life is this. A plan that worked perfectly for you last year may now have dropped your doctor, stopped covering your specific medication, increased your copays, or raised your maximum out-of-pocket limit by thousands of dollars. And unless you actively check and make a change before March 31st, you are stuck with whatever your plan has become for the rest of 2026. I want to tell you about a man I will call Harold. Harold is 74 years old, a retired auto worker from Michigan who has been on the same Medicare Advantage plan for 4 years. He chose it because it covered his cardiologist, his blood pressure medications, and had a $0 premium. Harold is not someone who ignores his healthcare. He is careful and organized. But when his plan sent its annual notice of change last fall, Harold did the same thing most people do. He glanced at it, saw it was a long document full of fine print, and set it aside thinking he would look at it later. He never got back to it. What Harold did not know was that his plan had quietly dropped his cardiologist from its network for 2026, increased his specialist copay from $35 to $85, and removed one of his blood pressure medications from its formulary, meaning he would now pay full price for it. Harold found all of this out in February when he went to his cardiologist appointment and was told his insurance no longer covered that doctor as in-network. By that point, the annual enrollment period had already closed, but Harold still had one option, the Medicare Advantage Open Enrollment Period, which runs from January 1st through March 31st. Harold had until March 31st to switch to a plan that covered his cardiologist and his medications. He made it, but just barely. He told me afterward, "I had no idea I had a second chance to fix this. If nobody had told me, I would have been paying out of pocket for my heart doctor all year." Harold's story is happening to seniors across the country right now, and March 31st is the deadline that could save them. So let us be very clear about what this open enrollment period actually is and what you can and cannot do during it. The Medicare Advantage Open Enrollment Period runs every year from January 1st through March 31st. This is completely separate from the main annual enrollment period, which happens in the fall from October 15th through December 7th. During this January through March window, if you are currently enrolled in a Medicare Advantage plan, you have the right to switch to a different Medicare Advantage plan that better fits your needs. You also have the right to drop your Medicare Advantage plan entirely and return to original Medicare. And if you do that, you can also join a standalone Medicare Part D prescription drug plan at the same time. What you cannot do during this period is switch from original Medicare into a Medicare Advantage plan for the first time. This window is specifically for people who are already in Medicare Advantage and need to make a change. Now here is where things get very important, and this is the part that catches most people off guard. Many seniors assume that if their plan has changed, someone will contact them and offer them a better option. That is not how it works. Medicare does not call you and say your plan dropped your doctor. Here is a better plan. The responsibility to review your coverage and make a change falls entirely on you. And after March 31st, that responsibility becomes irrelevant because the window is gone. Here is what you need to check right now before March 31st. First, is your primary care doctor still in your plan's network? Call your doctor's office directly and ask whether they are still accepting your specific Medicare Advantage plan in 2026. Do not rely on the plan's online directory alone. Those directories are frequently outdated. A direct call to your doctor's office takes 5 minutes and gives you a definitive answer. Second, are your most important prescription medications still covered by your plan's formulary at an affordable tier? Log into your plan's website or call the member services number on the back of your insurance card and ask them to check your specific medications. If any of your medications have moved to a higher cost tier or been removed from the formulary entirely, you are paying more than you should be. Third, what is your plan's maximum out-of-pocket limit for 2026? This is the most important number most people never look at. It is the absolute most you would have to pay in a year if something serious happened to your health. In 2026, some Medicare Advantage plans have out-of-pocket maximums exceeding $8,000 or even higher. Knowing your number tells you your financial exposure if you get sick. And here is something that surprises many retirees. There is help available to review all of this completely free. Every state has a program called SHIP, the State Health Insurance Assistance Program, which provides free one-on-one counseling to Medicare beneficiaries. These are trained counselors who will sit down with you, review your current plan, compare it to other options available in your area, and help you understand exactly what switching would mean for your doctors, your medications, and your costs. This service costs you nothing. You can find your state's SHIP program by visiting Medicare.gov or by calling 1-800-MEDICARE, which is 1-800-633-4227. I need to pause here and give you an important warning. Because March 31st is a known deadline, you may receive phone calls, mailings, and online advertisements from Medicare insurance agents and companies urging you to switch plans before the deadline. Some of these contacts are legitimate, but some are not. You should never feel pressured to switch plans on the spot during a phone call. You should never give your Medicare number to someone who contacts you unsolicited. And you should never pay anyone to help you switch Medicare plans. Legitimate insurance agents earn a commission from the insurance company, not from you. If anyone asks you for money to help you change your Medicare coverage, that is a red flag. Use the free SHIP counseling service or go directly to Medicare.gov to make any changes. Here is your complete step-by-step action plan before March 31st. Step 1. Pull out your Medicare Advantage insurance card and find the member services phone number on the back. Call them and ask for a summary of your 2026 benefits, including your premium, your deductible, your specialist copay, your out-of-pocket maximum, and whether your primary doctors are still in network. Write everything down. Step 2. Make a list of your 5 most important medications and call your plan to verify that each one is still covered and at what cost tier. If any have changed significantly, that alone may be reason enough to consider switching. Step 3. Go to Medicare.gov and use the free Plan Finder tool. Enter your zip code, your medications, and your preferred doctors, and it will show you every Medicare Advantage plan available in your area with a side-by-side cost comparison. This tool is free, official, and takes about 20 minutes to use. Step 4. If you find a better plan, you have until March 31st to enroll. You can switch online at Medicare.gov by calling 1-800-MEDICARE or by contacting the new plan directly. Your new coverage will begin on the first day of the month after you enroll. Step 5. If you decide to switch back to original Medicare instead, contact Medicare directly and also enroll in a Part D prescription drug plan at the same time to avoid a coverage gap for your medications. For caregivers and family members, please take 30 minutes before March 31st to sit down with the senior you support and go through these steps together. Many elderly beneficiaries received their plan's annual notice of change in the fall and never fully reviewed it. What seemed like a minor document may contain changes that are costing them real money right now. Your help in navigating this before the deadline closes could protect their healthcare access and their financial stability for the rest of 2026. The bottom line is this: March 31st is not an arbitrary date. It is the last day of the only second chance Medicare gives you each year to fix a plan that is not working for you. After that date, you are locked in until January. Your doctors, your medications, your costs, all of it stays exactly as it is in your current plan for the rest of the year. You have a few days left. Use them, check your coverage, compare your options, make the change if you need to, and share this video with every Medicare beneficiary you know, because this deadline will pass quietly for millions of seniors who simply were not told it existed. Your healthcare matters, your money matters, and you deserve a plan that actually works for you in 2026.